Have you ever wondered why some people suffer from severe stomach pains, while others can eat hot and spicy foods without any discomfort? It's a question that's crossed many minds, and the answer might surprise you. It's not just about having a strong or weak stomach. It's a complex issue that involves many factors. One of the most prevalent and often misunderstood factors is a medical condition that affects millions worldwide. Well, one reason could be a medical condition known as peptic ulcer disease. Peptic ulcer disease, often just called ulcers, is a condition that affects millions of people worldwide. Peptic ulcer disease refers to painful sores or ulcers that develop in the lining of your stomach, lower esophagus, or the first part of your small intestine, known as the duodenum. These ulcers are the result of the stomach's protective mucus layer becoming damaged and the stomach acid eating away at the tissues underneath. Now, there are two main types of peptic ulcers to consider: gastric ulcers and duodenal ulcers. Gastric ulcers form on the inside of the stomach. Imagine a small, painful crater formed by your stomach's own acid. It's not a pleasant thought, is it? On the other hand, duodenal ulcers develop in the upper part of your small intestine, the duodenum. While both types of ulcers are grouped under the umbrella term peptic ulcer disease, their specific locations in the stomach and duodenum can lead to slightly different symptoms and complications. For instance, gastric ulcers may cause pain shortly after eating, while duodenal ulcers might cause pain when the stomach is empty, often during the night or between meals. Understanding the type and location of an ulcer is crucial in determining the most effective treatment. It's also important to know that peptic ulcers are not caused by spicy food or stress, as was once believed. In fact, most peptic ulcers are the result of an infection with a bacterium called Helicobacter pylori, or H. pylori for short, or from long-term use of non-steroidal anti-inflammatory drugs known as NSAIDs. So while the term ulcer might make you think of a minor inconvenience, peptic ulcer disease is far from a simple bad stomach. It's a serious condition that requires careful management. Left untreated, peptic ulcers can lead to complications such as bleeding, perforation, and even an increased risk of stomach cancer. So peptic ulcer disease is not just about having a bad stomach. It's a serious condition that can have significant health implications. So what causes these painful ulcers to develop in the first place? Well, two primary culprits are often at the heart of peptic ulcer disease: a bacteria known as Helicobacter pylori, or H. pylori for short, and non-steroidal anti-inflammatory drugs, better known as NSAIDs. Let's talk about H. pylori first. This sneaky little bacterium makes its home in the protective mucus layer of your stomach and duodenum, the first part of your small intestine. Normally, this mucus layer acts as a shield, protecting your stomach and duodenum from the harsh, acidic environment necessary for digestion. But H. pylori has an arsenal of weapons. It produces enzymes that neutralize stomach acid, allowing it to survive. Over time, its presence can lead to inflammation and damage to the protective mucus layer, leaving the underlying tissues vulnerable to stomach acid. And that's how an ulcer forms. Now, let's shift gears and talk about NSAIDs. These are common over-the-counter drugs like ibuprofen and aspirin, often used for pain relief, but they have a downside. NSAIDs block an enzyme called COX-1. This enzyme helps produce compounds that protect the stomach lining. So, when NSAIDs block COX-1, they're essentially turning off the body's natural defense mechanism against stomach acid. Over time, this can lead to the development of ulcers. It's important to note that not everyone who has an H. pylori infection or takes NSAIDs will develop an ulcer. There are other factors at play, including genetics, lifestyle choices like smoking and alcohol consumption, and certain other medical conditions. But understanding these primary causes gives us a solid foundation for both prevention and treatment. Understanding these causes is crucial in both preventing and treating peptic ulcer disease. Now that we know what causes peptic ulcer disease, what are the signs that someone might have this condition? Peptic ulcer disease often makes its presence known through a variety of symptoms, most commonly abdominal pain. This isn't your everyday stomachache. It's a gnawing or burning sensation that can be felt anywhere from the navel up to the chest. This pain can last for a few minutes or several hours and often comes and goes for several days or weeks. Another prevalent symptom is bloating. We all know the feeling of being overly full after a hearty meal. But with peptic ulcer disease, this discomfort may become a frequent and unwelcome guest. It's a sensation of fullness, typically in the upper abdomen, that doesn't seem to go away, even when you haven't eaten. Nausea is another symptom that may occur. It's that unpleasant, queasy feeling in the stomach that sometimes precedes vomiting. However, not everyone with peptic ulcer disease will experience nausea, and not all nausea is a result of peptic ulcers. Now let's move on to the diagnosis. If a doctor suspects peptic ulcer disease, they may order an endoscopy. This procedure involves passing a thin, flexible tube with a camera on the end through the mouth and into the stomach and duodenum. This allows the doctor to see any ulcers and assess their size and severity. Another diagnostic tool is a breath test. This non-invasive test requires the patient to drink a clear, tasteless liquid that contains a substance that H. pylori bacteria, often responsible for peptic ulcers, will break down. Later, the patient breathes into a bag, which is then sealed. If the bacteria are present, the breath sample will contain the broken down substance. In some cases, a blood or stool test may be used to detect H. pylori bacteria. However, these tests may not be as accurate as an endoscopy or breath test. So, if you or someone you know is experiencing these symptoms, it's important to seek medical advice. Because peptic ulcer disease, if left untreated, can lead to complications that are far more serious than a stomachache. Thankfully, peptic ulcer disease is treatable. But how do doctors manage this condition? Let's dive into that. The primary aim of treatment is to kill the H. pylori bacteria, if present, heal the ulcers, and prevent their recurrence. This is typically achieved with a combination of antibiotics and medications that reduce stomach acid, such as proton pump inhibitors. These inhibitors block the action of the tiny pumps within the stomach lining cells that produce acid. In cases where ulcers are caused by long-term use of non-steroidal anti-inflammatory drugs, or NSAIDs, it may be necessary to change the medication or add a protective medicine to reduce the risk of further ulcers. However, treatment goes beyond just medication. Lifestyle changes play a crucial role in managing peptic ulcer disease. This might include avoiding spicy foods, alcohol, and caffeine, which can irritate the stomach lining and exacerbate symptoms. Equally important is the prevention of peptic ulcers. This often involves the same strategies as treatment, such as reducing the use of NSAIDs, treating H. pylori infections, and adopting a stomach-friendly diet. Remember, everyone is different. What works best for one person may not work as well for another. Your healthcare provider can help tailor a treatment and prevention plan that fits your unique needs. With the right treatment and preventative measures, it's possible to live a symptom-free life with peptic ulcer disease.